Hello everyone. I'm making this short presentation because there is a RCS Glasgow in England exam in Chennai on starting from Friday 24th. So some candidates asked me that I should make something for the Part B, right? So in a Morth Glasgow exam, there are three components basically. One is a Part A, that is MCQs and 12 SCQs, 50 MCQs. And then they used to say a written component in the Part B, right? So this is basically OSCEs. So there are 13 OSCE stations with two rest stations. And these days, these OSCEs are being done online, right? So you have to type it on your system, but they will show you questions with sub-questions. And mostly those questions are clinical questions because that's a OSCE. Because in the Part A, especially in the SAQs, they give both the clinical and the non-clinical SAQs. But here, there are sort of SAQs which are clinical. So the mostly they used to give growth rotations, growth prediction, but if it's a high angle case, what are the Biot's 7 structure signs for high angle cases or low angle cases, supernumerary teeth, impacted canines. Even they asked you to write a complete sheet for the lab for the design of the twin block, right? So there are 13 of OSCE stations and 2 rest stations. So that's called the written. So they are doing the written first. And but in every exam, they are doing previously the OSCEs were physical. Now they are doing it online. When they were physical, even they were going for this pass scoring, right? They were giving candidates a pass ruler and asking them to score a certain aspect of a peer assessment rating. Or they were asking you to put IoT on a specific case. So anyway, so 13 OSCE station with 2 rest stations. So that's totally 15. And that carries 3 marks in total, but in the result, that carries 3 marks. So they have the OSCE that carries 3 marks. Sorry, the ROSCE, so the written 3 marks. Then they have the communication, 2 communication stations that carries 3 marks. Then your on cases that carries but they have divided your on cases into 2 components. And they will mark in absentia and they will mark when you are there, your defense. So that carries 6 marks. And then but the unseen cases, the SCRs, that carries 6 marks, 2 cases each, right? They will do it in 2 sessions. So total of but one has to gain total of 18 numbers with the written or 15 number basically in the but the clinical component. And there's some compensation but I believe that it can go for a compensation in one component but if you have 2.5 in one component and you gain 3.5 or 4 3.5 from the other component or 4 from the other component, you will pass. So I'm not exactly sure what is the level of compensation, but there is compensation at least in one component. So after the OSCEs, they usually go for before 1 month before the exam, you people are supposed to submit your own cases, right? And the examiner will mark them in absentia, but you won't be there. So the presentation should be very good. The superimposition should be very good, right? And just one thing with the candidates usually make a mistake, or two things, in fact. Number one is superimpositions. In superimposition, people use the WebSef for tracings and superimposition. And both in Glasgow in England, they ask for the structure superimposition. And the WebSef is very poor for structure superimposition. In fact, it is superimposing on the ascent plane, the anterior contour of the palate. So try to use Dolphin or go with the manual superimpositions, right? Because I've seen copies of many candidates which went with WebSef, and but the superimpositions were not correlating with the treatment changes and the cephalometric values, right? So the copies presentation should be good, and the Royal College has its own template because some people use the old template of Edinburgh, which do not have these many things what etiology is not there, rationals is not there. So you have to write the rationals, the etiology, right? The problem list. So everything you have to write there because these things are not in the Edinburgh. So use the right templates. That's quite something. That is something quite important. So the second component is but obviously the defense. So there would be 3 marks of your presentation and the quality of your cases. And in the exam, they will examine you for 30 minutes for two of your cases, the best cases, the case green and the blue, most of the times, right? So they would be examining you in 30 minutes for your cases. And these cases are supposed to be submitted like but 1 month before the exam at least, like but this time I think the deadline was 10th of November and the exam is on 27th. The and like but I think yes, 26th or 27th, right? I'm not very sure, but in these dates. So in the exam, they will like what you don't need to bring physical models and your physical copies. They will print themselves. In the exam, they would have the printed copies. And for the models, physical models, like but you can take pictures of the physical models, or it's best that you make like what go for the scans and go for the digital copies of the models, right? And put it in your own copies. And in the SCRs, as I told you, there are two components, SCR1 and SCR2. So two cases would be examined in one go and other two in the other go. Might be on the same day or might be on two consecutive days. So that carries like a 3, 3, 6 marks. So these are the same, like at Edinburgh, Glasgow, everyone do the same. It's 15 minutes, like but for 15 minutes, you will look one of your provided case, like what case that is given to you, and then 15 minutes, two of the examiners will examine you. So for the first 7.5 minutes, uh, they will examine you for the diagnosis part, like extraoral, intraoral, the basic things. And then in the next 7.5 minutes, the treatment planning. Also, the same thing happen when it's your own case. They examine you first on the diagnostic part and then on the intraoral part, right? The treatment planning part. So it should be evidence based. And they have these rubrics, like, but they have 5 marks, right? 5 points for every questions. And if someone went with the evidence based answer, they give you maximum marks, right? So they check everything from diagnosis to biomechanics and treatment planning. And then, like, but there are two communication stations. The difference from Edinburgh in communication station is that in Edinburgh, they give you 5 minutes before the exam to look at the communication station and 10 minutes for communication itself. Here, they give you 10 minutes and 10 minutes for the communication itself, right? So total of 20 minutes for the communication station. And the communication is the same, like, but you go there, the communication essentially has three components: the start, which is mostly objective, you prepare it from home; the middle, where you answer the patient questions; and the end, you have to end it by speaking certain lines, right? So that is it. Like, but in future, I will make some detail of like, but presentation for every component, right? So as candidate asked me that it should be like, but they at least know that what is going to happen there. So I went for this presentation. Thanks a lot. If you have any questions, you can write it down, right? And I will try to answer it. Thanks a lot.